alaykum. Hurmatli opa-singillar, aka-ukalar, vatandoshlar. Yana jarayonni davom ettirish maqsadida yana video qildik, xudo xolasa. Mana endi biz hozir Orifxon bilan Jigar Peresatga qiladigan doktor oldiga kirdik. Hozir ular o'zlarini tanishtiradi va qolgan sizlarni qiziqtirgan savollarni berishga harakat qilib beraman, xudo xolasa. Bu savollarga qisqacha javob olishga harakat qilamiz. Marhamat qilib o'zingizni tanishtirsangiz.
क्या सर आप अपने बारे में और टीम के बारे में इंट्रोड्यूस कर दीजिए।
अस्सलाम वालेकुम, वेलकम टू इंडिया।
हिंदुस्तान का कुछ क्लिप्स देखिए।
तो we are one of the largest liver transplant teams in India.
हिंदुस्तान के एंकर तस्लीगा ट्रांसप्लांट लोग come on the service all of this.
And as a group, our team has done around more than 4,000 liver transplants with good results, acceptable results compared to worldwide standards.
तकरीबन 20 मिलियन कोपरोग के ट्रांसप्लांट से किलगामी से मुआफ़क़ दरस सम जुदा याफ्ते हैं।
And we have been working with patients and our partners from Uzbekistan for a long time now. We have very good relation with all of them, and we have treated almost more than 250-300 patients from Uzbekistan successfully for liver transplant.
तकरीबन इसको कोपरोग वास्तव में उज़्बेकिस्तान लाने के लिए हम इसको कोपरोग का सदर उज़्बेकिस्तान के लाले तकरीबन उज़्बेकिस्तान दान कुछ यूज़ तक कोपरोग ट्रांसप्लांट से बोगन का सदर बोलेंगे वे हम उस नतीजे से जुदा याशिक लाने यानी ऑपरेशन के लाने नेम और सर टीम
So I am Dr. Rajesh De. I am a surgeon.
इसमें डॉक्टर राजेश डे again ट्रांसप्लांटोलॉग again.
Our team consists of there are more than 50 doctors and lot of staff. So they're complete. If you want take the entire team, it will be almost like 100 to 150 members, including staff, including doctors, because everyone is important in liver transplant. It's a big team.
ट्रांसप्लांटोलॉग ग्रुप वाले कमांडर से दा तकमीना नार्कोस डॉक्टर असोसिएट से करे दिगा सिस्टरल हम सब कोशिश ऐसा देखते तकमीना यूस्टरदान कोशिश रोक कमांडर से दा बिजनेस कमांडर से इसलिए दिगा डॉक्टर
Yuztadan oshiq oshiqlar bor. Endi bizni yurtdoshlarimizga qizig'i shu savollar hozir ko'p bo'lyapti. 3 ta savol. Shu jigar kasalligiga chalinmaslik uchun mana har xil yomon deylik mana onkologisk kasalliklar bor. Mana gepatit, B, C har xil toifalari bor, to'g'rimi? Shu kasalliklarga chalinmaslik uchun inson nimalarga ko'proq e'tibor berish kerak? Doktor sifatida bir maslahat bersa bizni ko'rayotgan yurtdoshlarimizga.
क्या सर उज़्बेकिस्तान में मोस्टली पेशेंट जो होते हैं वो लीवर के पेशेंट हैं हेपेटाइटिस दे आर अफेक्टेड फ्रॉम हेपेटाइटिस बी सी सिरोसिस सफरिंग फ्रॉम लीवर ट्यूमर so what they can do, how they can prevent?
How they can prevent? First is Uzbekistan, I think, has started a vaccination program for hepatitis B very recently. So as years go on, vaccination picks up. So gradually the number of hepatitis B patients will come down in Uzbekistan.
En asosiysi O'zbekistonda oldin yakinda aytib xabarim bo'yicha yakinda vaksina boshlagan ekan deb qancha bu narsani tezroq rivojlanib ketsa boshqa ko'proq yangi kelgan dunyoga ya'ni tug'ilgan bolalarga chaqaloqqa vaksina kelsa bu narsani sekin sal
kamayadi demoqchilar. Endi ikkinchi savolim shu kasallikka chalingan bemorlar nimalarga ko'proq e'tibor berish kerak, nimalar qilish kerak kelajakda o'zini kasalligini rivojlanib avj olib ketmasligi uchun uzoqroq deylik keladiganlar kelib operatsiya qildirish imkoniyati borlar bor, imkoniyati yo'qlar bor, hammani sharoiti har xil. Shuning uchun shu kasalliklarga chalinib qolgan insonlar bu yerga keladigan imkoniyati yo'q insonlar o'zini qanaqa qilib ehtiyot qilsa bo'ladi, nimalarga ko'proq e'tibor berish kerak?
Sir, he's asking that most of the patients they didn't have enough money to come to India for surgery. So, what they can do to make some curable things from cirrhosis or hepatitis B or C? How they can take more time? They can, so they can get the money from NGOs or from families.
I think first of all, Mr. Arif and their company is doing very good work by helping patients, poor patients, patients who do not money to organize money and come over here and get a transplant. Because otherwise, only rich people used to come to India to get a transplant. But with their help and with their organization, they are helping a lot of poor people who could not even dream of having a transplant to come over here, get a transplant, and they are going to do good follow up. They keep a good track of such patients in Uzbekistan, how they are doing after 1 year, 2 years. They are doing quite well. So that is one part of the question.
And one more question which is added. Some patients they have only hepatitis B. So how can they get better by getting treatment, or they go for surgery in future? It is mandatory, or they can cure with medicine?
No, hepatitis B can happen in many stages. Only when the liver becomes very damaged, there is liver tumor or there is cirrhosis, then they need a liver transplant. Before that, they can be continued on treatment medicines for a long time.
Adetde birinci kasinsorlar narsalar O'zbekistondan asosiysi kimdir? Misol uchun bo'lmaganlar, kambag'al kasallarga asosiysi adetda bizniki gruppasida Arifxonning gruppasi bor ekan, hattoki bu yerda ko'rgan shunaqa kasallar ham bor ekan, ko'rsa umuman imkoniyati yo'q. Lekin bizlarga aytibdi, sizlar ularga fondan boshqa joydan pul olib berib, ularga operatsiya qildirib, hattoki operatsiyadan keyin kelganlar bor ekan. Shunaqa kasallar, kambag'al kasallar. Keyin ularga yaxshi nazoratda olyapsiz. Chunki operatsiya bo'ldi, bu eng muhim narsa emas. Operatsiyadan keyin nazoratda olish bu eng muhim narsa ekan. Shu bizning gruppaga rahmat aytibdi kattakon. Shu narsa qilgani uchun. Ikkinchisi gepatit B bo'lgan kasallar uchun lecheniya qilsa bo'ladi. Sirrozga o'tmaslik uchun yaxshiroq lecheniya qilish kerak. Doktorniki nazoratda bo'lishi kerak.
Mana men aytmoqchiman, shu sirroz bo'lib qolgan, o'sha sirroz bo'lib ulgurganda bu insonlar, bemorlar sirroz bo'lgan haqiqiy kasal bo'lsa, shu yeyayotganda, jismoniy harakat qilayotganda nimalarga ko'proq e'tibor berish kerak, kasalligi avj olib ketmasligi uchun.
Sir, our next question is that if a patient affected by cirrhosis, so what they can do to take some more time?
So cirrhosis doesn't mean that it is a transplant. The liver has a lot of reserve to help the patient live for, many patients live for 10 years, 12 years with cirrhosis if they follow proper medicines, if they follow proper diet, if they take good amount of protein in the diet, avoid smoking, avoid alcohol, then they can live long for without a transplant with cirrhosis also. For 10-12 years they can at least continue.
Aytdi cirrhoz bo'lgan kasallar agar o'ziniki yeydigan narsalar, vitaminli, protein narsalar, yaxshiroq ovqatlanish, shu narsalar bo'lsa, sigaret chekmasa, aroq yo'q shunaqa narsalar ichmasa, bu degani ko'proq 10 yil, 12 yil, balki 15 yil shu nima qilsa bo'ladi, operatsiya qildirmasdan yursa bo'ladi. Sirroz degani har bitta sirroz bo'lgan kasalga sirroz operatsiya qilish shart degani yo'q.
Tushunarli. Endi rahmat, endi oxirgi savolimni bersam tezroq. Shu mana kelib operatsiya qildirgan, jigarni peresatga qilgandan keyin endi guvoh bo'lyapmiz, kimlardadir boshi aylanib, mazasi qochib qolyapti, yoki isitma kelib qolyapti. Shunaqa holatlar ham bo'lyapti-da. Shuning uchun mana kelib Hindistonga kelib jigar peresatga qilgizib ketgandan keyin O'zbekistonga shu yana mazasi qochib, yana deylik oshiqcha muammo bo'lmasligi uchun nimalarga e'tibor berish kerak, nimalar qilish kerak? Uni ketayotganda bu yerga kelib operatsiya qilib olib ketayotgan bemorlarga o'zi doktor tushunadi bu narsani, bemorlarga aytmayapman. Kelajakda bizni ko'rib turgan, bilmagan shu narsani bilmagan tomoshabinlarga yetkazish maqsadida bu savolni beryapman. Shu operatsiyadan keyin, davolangandan keyin yana mazasi qochib, yana holati yomonlashmasligi uchun nimalarga ko'proq e'tibor berish kerak bemorlar?
So last question, post-transplant patient, mostly some patients are going suffering from fevers, they are suffering from jaundice. So different type of problems are happening in post-transplant patient. So what they can do to cure for this?
Most importantly, that we have developed a system, we have developed a flow chart, and Mr. Arif and his team keeps a very close track of patients every day. They follow up patients. That is the most important part. So even if they have problem, they can be picked up very early, and we can consult and take treatment. That is most important before they become bad.
Aytibdi bizda daftarda ramiz kasallarga aytibdi operatsiyadan keyin shu doimiy shu daftarda to'ldirib, misol uchun bizning bu yerda operatsiya bo'lgan kasallardan biz har doim o'zingiz so'raymiz kasallardan, analiz topshirdingizmi, yubormadingiz, shuncha vaqt bo'ldi, yaxshimi, hamma narsa deb so'raymiz. Shu eng asosiy narsa bizning ishimiz ham bor ekan, bu kasallardan vaqtida analiz topshirsin. Keyin agar bu narsa bo'lishi mumkin deyapti operatsiyadan keyin, chunki lekin ko'proq muammo ko'paymasdan bu narsa agar vaqtida analiz topshirib yuborsa, u narsani osonroq hal qilsa bo'ladi.
Yeydigan narsalarini, mumkin emas narsalarini yemasdan ehtiyot bo'lib yursa, demak hammasi yaxshi bo'ladi.
Yaxshi bo'ladi.
Faqat o'zini tezda yaxshimi, yomonmi
doktorning aytgan vaqtida analizlar topshirish, dodasi to'g'ri ichib tursa, yaxshi bo'ladi.
Rahmat kattakon bergan ma'lumotlaringiz uchun. Kattakon rahmat. Mana hurmatli yurtdoshlar, ko'rdinglar. Endi ozmi ko'pmi rozi bo'lasizlar. Manchalik savol javob qilib, shunchalik nima qilishga, gaplashishga harakat qildik. Orifxon bilan yo'q demadilar. Kattakon rahmat sizga ham. Sog' bo'linglar, salomat bo'linglar. Rahmat.
Sizga ham rahmat.